Prompted by his son, Harold has come in for a visit to discuss the new medication he started. His hemoglobin A1C goal is less than 7%, a decision he made with his physician due to his age, short duration of diabetes mellitus, and minimal disease complications. To reach that goal, he has started taking a sulfonylurea medication, but since then he started to feel shaky and sweaty. You just talked with him about how to be aware of and prevent hypoglycemia, and now you want to use TeachBack to ensure he understands.
We talked about a lot of things today, and I want to make sure that I explain things clearly. So would you explain, in your own words, what signs or symptoms might let you know that your blood sugar is low?
Well, it might be low if I'm feeling shaky or jittery. I think it might be low if I start to feel groggy.
Great. And is there anything else that you or your son might notice?
You said some other things, but I just don't remember.
Well, let's go over them together. So, feeling hungry, sweating a lot, having headaches, or feeling confused or weak are all signs that you have low blood sugar.
Okay, got it. Hungry, sweating, and headache, but I'm a young man. I'm not going to get confused.
And Chris, you can be on the lookout for these signs also.
You bet.
So, Harold, when you have any of these signs or symptoms, what will you do?
I should write them down.
Okay. And what else would it be good for you to write down when you feel like you're having low blood sugar?
If my glucose level is low, I should write down what I was doing. Last time I ate something, and my finger stick reading.
Right. And it's a lot to remember, though, so I'm going to give you this pamphlet that you can read to remind yourself what we talked about today. And Chris, you can have one also.
Great.
I know this can be overwhelming. Diabetes is a very complicated disease. I saw in your chart that you've had depression in the past. Have you been feeling depressed lately?
No.
I'm glad to hear that. And you know, a lot of people with diabetes have trouble remembering to take their medicine all the time. Do you ever miss taking your medicines?
In the beginning I did, but not so much anymore. Plus, Chris here reminds me to take them. He's always nagging me to take better care of myself.
You gotta take care of yourself, Dad.
I know.
You think Harold understands the signs and symptoms of hypoglycemia, but you also want to make sure he knows what to do when his blood sugar is getting low.
Okay, so you know the signs and symptoms of low blood sugar. Can you tell me in your own words how you'll get your blood sugar back up if it's too low?
If my glucose level is below 100, I should eat something.
Actually, if it's below 70, you should definitely eat something. 100 isn't considered too low.
Oh, okay. If it's below 70, I should eat something.
Yes. And then what would you do?
Check again in 15 minutes.
And if your blood sugar is below 70, what's good to eat?
Should probably eat hard candy, orange juice, honey, or sugar, but I don't think I want to eat a spoonful of honey, though. Yuck.
Well, be sure to keep some hard candy around the house then. And Chris, can you help make sure your dad always has candy on hand just in case?
Sure.
Great. So, Harold, I'm glad you know what to do if your blood sugar gets too low. What can you do to prevent having low blood sugar in the first place?
I can eat 3 meals a day, breakfast, lunch, and dinner. I'm going to buy a box of protein bars to have in the truck so I can have for lunch in case I'm having to drive around town all day.
That is a great idea. So one more question. When should you call Dr. Brown about your blood sugar?
I should call Dr. Brown if my blood sugar is below 100. No, below 70, more than once or twice.
Good. Now, there's also information about these things in the pamphlets I gave you in case you're ever in doubt. If the changes in your diet don't work, Dr. Brown may want to change your glipizide to another medication, but let's try this for now. All right?
Sounds good to me.
The visit ends with you asking Harold to show you how to use a blood glucometer and arranging for a follow-up visit. You also provide him with community resources for people with diabetes.